Good morning, everyone, and welcome to another Medical Minute with Colorado Springs Orthopaedic Group. Today we're sitting down with Dr. Jamie Friedman to talk about meniscus repairs. So what exactly is the meniscus?
So the menisci, which is plural for meniscus, are two C-shaped structures in the middle of the knee joint on the outer and inner edge. You can see in this model right down here that they lie in between the femur or the thigh bone and the tibia, the shin bone. They provide a shock absorber of the knee as well as protect the cartilage and are a secondary stabilizer of the knee joint itself.
How is this most commonly injured?
These can be injured in two different ways. Really, there are traumatic acute injuries, which can happen when there's a rotational force while the knee is flexed, or they can happen with repetitive wear and tear, such as just degenerative knees.
And what are the most common symptoms you see after somebody does injure their meniscus?
So after an acute meniscus injury, the patient may feel pain on the inner or outer part of the knee, sometimes in the back of the knee as well. They may also have some delayed or minimal swelling. Many times they'll have mechanical symptoms such as clicking, locking, or popping when they straighten or bend their knee. This can be reproducible with things like deep knee bending. For degenerative tears of the meniscus or other type of meniscus tear, they may have pain that comes and goes with certain activities, but they may have minimal to almost no swelling with that.
Let's talk about some of the different treatments that people could do, because there's a couple different ways that they could go.
Yeah, of course. So in a degenerative meniscus tear, these are our older patients where it's happened over time with wear and tear. We'll typically start with conservative, non-operative treatment. This means rest, ice, anti-inflammatories, sometimes physical therapy, or even an injection. For our younger patients who sustain an acute traumatic tear of the meniscus, a lot of times we have to go with surgery. Now, what surgery entails is either trimming out part of the meniscus, called a partial meniscectomy or debridement. This is for smaller tears or tears that are not amenable to fixation. In other tears that can be fixed with stitches, we'll do this arthroscopically and stitch the meniscus back together. Regardless of which treatment we do, we always try and leave as much meniscus tissue there as possible because that will prevent early degenerative arthritis.
And what is the recovery time we're looking at for a meniscus repair?
So when we do something simple like a partial meniscectomy or debridement, as I talked about, those people can be back to activities and full weight bearing within a few weeks. But when we do a repair, this is a longer recovery. We have to allow that tissue to actually heal. So patients will wake up in a brace and be partial weight bearing for the first 6 to 8 weeks. They'll be working on range of motion and strengthening exercises. At about 3 months, they'll add in more straight line running or jogging, and by 4 to 6 months, they'll usually be back to their normal activities.
Perfect. Well, thank you so much for all of this information today.
Of course.
And for more information on Colorado Springs Orthopaedic Group, you can go online to csog.net.
Mia, thanks so much. All of that info up on your screen right now, and this segment has been sponsored by Colorado Springs Orthopaedic Group.